Hello, a very good evening to all of you. Today we are going to discuss case note of Mr. Christopher Ford. So you are going to write this letter to the district nurse. We don't have the address here, the PIN number, nothing. We just have know the name. We just have the designation, that's district nurse. And the purpose of our letter is to request the district nurse to request her to have home visits for Mr. Fort to ensure medication compliance and dietary restrictions. So that's the reason why we are writing the letter. We are writing to the district nurse for requesting her or him home visits for Mr. Fort in order to help him stick to the medication compliance and diet restrictions which are advised here. So let us go ahead and see the case of Christopher Ford. Here you can see Christopher Ford is a 49-year-old man who lives with his wife and two children. And yesterday, that was on 20th February 2020, he presented with the suggestive symptoms of myocardial infarction, and later his investigations showed that he has myocardial infarction, that is ST elevation. All these things confirm that myocardial infarction, confirming that we have done the angiogram. That was on 21st February. So when you did the angiogram, you have seen that the presence of clots on the left side of the coronary artery. And this was the intervention that was PTCA was done on the same day. So we have the medicines here: pantoprazole 40, aspirin, statix 40 mg, paraffin 10 mg. These are the medicines which are very important because you are going to write to the district nurse to request medication complaints. Now we have something very important here in the medical history, that he has some peptic ulcer for which two clippings were done, hypertension 8 years, diabetes mellitus we have for quite a long years, and these two medicines also should be added to the list of the medication because you are writing to the district nurse. So we need to say that these medicines are going apart from what the medicines we have started for a month, that is pantoprazole, status and all, paraffin and all. So we have two more medications in addition to these things which are going regular. Now let's go ahead with the diet here. See, we can see that recommended by the dietitian. You have seen that the patient is a chronic smoker and an alcoholic, and he loves sugary foods and oily foods. So the dietitian recommended him to avoid oily foods and carbohydrates, and instead increasing the green leafy vegetables, fruits and vegetables, fluid intake. So this is what the restrictions on oily and sugary foods, and the recommendation for fruits, vegetables, and fluids. So this is something important after the medicine. So we are writing the letter to the district nurse for two particular reasons. The first thing is to adhere to the medication complaints. We have a list of medicines there, and we have some dietary restrictions here, that is on oily foods and carbohydrates. Apart from that, we have to focus on something else, that because he is a chronic smoker and alcoholic, so this also is important here. So we need to have the acute line programs. So instead of medicine monitoring and dietary management, we have quitline programs. In addition, we have something else here in the discharge plan is the monitoring of the blood sugar and blood pressure, and encourage him to do daily exercise here. So that's it. Now, you can combine this thing in this daily exercise, and now for for the first 2 weeks, no strenuous exercise, so you have to add that thing too. So you can combine that thing in a better way. And we have a scheduled follow-up on 3rd of March 2020 with his FBS and FLD report. So need to consolidate everything into a small letter, but the essence of the letter should not be lost. So let's look at the question once more. You can see you are not going to write chest pain radiating to shoulder, difficulty breathing, all these things. These information is not it's not relevant to the reader. So the reader needs to know the medication frequency, dosage, and all these things in detail. And we have to let him or her know the dietary requirements, all these things. Then we have, I told you something else, but we are not going to deal with what happened at the time of admission, what were the investigations done, all these things, and see height, weight, temperature, all these things are not relevant. These have to be excluded. Now, see, we have a lot of investigation reports. We are not going to do that because actions have already been taken. Medicines already have been prescribed, and we have dietary restrictions in place. What thing you have to do is that you have to closely monitor the blood pressure and blood sugar. If there is anything unusual, you need to report to the appropriate medical care. So that's something, and you have to strictly monitor the medication complaints and the dietary restrictions along with the recommended dietary pattern. And now we have to take care of the quitline programs and courage exercises and the scheduled follow-up care. That's it. So rest all things are not, it should not be addressed here in this letter. Now here in 21st February 2020, the district nurse, dear nurse, Mr. Christopher Ford, aged 49. The purpose of this letter is to request home visits for Mr. Christopher Ford in order to adhere him to ongoing medication complaints and dietary restrictions. So to help him adhere to ongoing medication complaints. So he has some medication complaints going on, so you need to help him sticking to that thing. He is being treated for myocardial infarction progressively, so he is in successful treatment for myocardial infarction. That's what we have written. We have not written something else. So he has his diagnosis as myocardial infarction that you have seen in the case now. So that's what we have written briefly. On confirmation of his diagnosis, that is myocardial infarction, Mr. Ford underwent a percutaneous transluminal coronary angioplasty today. So this is what we have written here. So we have just briefed it. What we are not going to explain all this is what ECG has taken, all these things reveal that the diagnosis, or else he had these difficulties. He was admitted on this particular day, and these were the complaints. We have a lot of things here to write other than that, so we just brief these things. On confirmation of his diagnosis, Mr. Ford underwent a percutaneous transluminal coronary angioplasty today. So this today is the landmark here. So once he was admitted, when he was admitted, is not written because we are not going to write 2 days because PTCA was done today. So if you want to write confirmation of the diagnosis was done yesterday, you can write it, no problem. But instead, I already mentioned that the myocardial infarction in the first paragraph. Confirming his diagnosis, it means it's quite understood, Mr. And post-operatively, he was commenced on the following medications for a month. So all these four medications have to be continued for a month. So we have listed these things with a colon. Pantoprazole 40 mg twice a day. So the frequency also should be there. Aspirin 325 mg. The frequency was not given. Status 40 mg and paraffin 10 mg. So the frequency which were given, it has to be given clearly. So everything we have said. A restriction was advised on foods which are high in oil and carbohydrates by the dietitian who advised the restriction. That's the dietitian. And which were the foods which are high in oil and carbohydrates. And instead, he was recommended to have green leafy vegetables. I can just cancel off this particular thing here. Just a minute. Green leafy vegetables. No, because we know not only vegetables, so was another vegetable. It's just a necessary increase of word count. So have green leafy vegetables, fruits, and plenty of fluid. So that would be nice. Mr. Ford lives with his wife and two children because we are going to write to a district nurse for a home visit. So the district nurse will be coming, or she will be sending someone to the home. So it is very necessary to know where Mr. Ford lives. So that's why we have written he lives with his wife and two children. On top of being a chronic smoker and an alcoholic, he lives a sedentary lifestyle. We have said three things here. He's a chronic smoker, he's a severe alcoholic, and he lives a sedentary life, because sedentary life means no exercise. So that's what the meaning of sedentary life is. He has a history of peptic ulcer for which clippings were done twice. So this is a relevant history because she should be taking care of the food, because she's taking care of the dietary requirements too. So she needs to consider, or he needs to consider, that the patient has had peptic ulcer and had two clippings done before, so has to be very careful with the food which is given, which should not be irritating, which should not be too spicy or hot. So this is very important as far as a district nurse or some other nurse who is visiting Mr. Ford's house, because they are dealing with the diet. So peptic ulcer, you should not exclude that. Don't think that it is an unnecessary data. It is a necessary data here, because it's a quiet reminder. It's a warning to the nurse who is visiting Mr. Ford's house. So peptic ulcer, two clippings were done. He has been tablet Nicardia. So he has some other tablets, tablet Nicardia once a day and human mixture twice a day for hypertension, diabetes mellitus, respectively. So if you're not, be very sure the use of respectively. So we have Nicardia 5 mg, human mixed start. So these two medicines are given for Nicardia for hypertension, human mixed start for diabetes mellitus. That's why we have used the word respectively there. Instead of writing two sentences, we made it one sentence there. About discharge form, Ms. Ford needs your support for monitoring his blood pressure. So your support, in the sense you can give support directly either, or by means of sending some supportive staff or other nurses or qualified nurses, home nurses, to monitor his blood pressure, blood sugar, diet, and medication. So this is what we have said. And kindly engage him in quit line programs and encourage exercise programs slowly and steadily. We have some information that he should not do strenuous exercise for 2 weeks. So if we write that thing together, that will be an additional information. So we just said that slowly and steadily. That's what we have written. So a medical personnel should know what you mean by slowly and steadily. So encourage exercise programs slowly and steadily. It was written exercise daily. So it is always better to write as it is daily exercises and avoid strenuous exercises. So it is always better to write like that. So just for understanding, we have just combined it together. So if possible, it's always better to be very clear that daily exercise and avoid strenuous exercise for 2 weeks. So if you can do that, that would be better. If not, he has his follow-up with requested reports on 3rd March. So that's also we have we have not written FBS, FLS, all these things. We said he has his follow-up with requested reports. So reports requested are written in the case note, so it is there. So we just are not giving importance to those things here, because we are giving importance to the medicines, and we are giving importance to the diet, and that's it. So then we have some discharge plan too. So that's it. That concludes our letter here. If you have any further queries regarding Mr. Ford's condition, please do not hesitate to contact me. Yours faithfully, Nurse. I hope this thing is very clear to you. Hope that we would see again soon. Till then, bye.